Okay, well, let's get started. Good afternoon, good evening, wherever you are in the world, and thank you for joining us for today's webinar entitled Data Science Solutions to Extreme Heat Events, Results of the HE2AT Centre project. My name is Brad Newsom, and I'm a program director at the Fogarty International Center here at the National Institutes of Health. So, I would now like to introduce today's speakers, Matthew Chersich and his team. Matthew Chersich is a research professor and executive director at the Wits Planetary Health Research Division of the University of Witwatersrand in South Africa, and a research fellow at Public Health and Primary Care School of Medicine at Trinity College in Ireland. He is a medical doctor who has worked on public health research across Africa for around 20 years and with the World Health Organization and other international organizations. After medical school at the University of Witwatersrand, Matthew studied public health at the London School of Hygiene and Tropical Medicine and doctoral studies at Ghent University, Belgium. His research covers the impacts of extreme weather on health, especially in pregnancy, and the assessment of adaptation interventions. He is leading the HE2AT Centre, which is part of the Data Science Initiative in Africa, a large common fund program here at NIH. Matthew will be presenting alongside his colleagues, Dr. Lakou, Jack, Brink, Makhanya, and Watambwa, and will be introduced along during the webinar today. At this point, let me turn it over to Matthew. Thank you all for being here with us today, and over to you.
Excellent. Thank you very much, and thanks everyone for attending. It's very pleasing to see such a large audience today. So I'll begin by introducing the HE2AT Centre and one slide on why this work is important. There's three reasons I really want to highlight of what formed the basis or guided us when we designed the HE2AT Centre. The first thing is that heat poses major risks for pregnant women and infants. There's physiological, behavioral, and cultural factors which all raise the risks of heat exposure and heat adverse outcomes of this exposure for this population group. It's really a highly vulnerable group for heat, but also multiple other adverse outcomes. The second part of the HE2AT Centre we're focusing on is urban heat islands. And this is here really heat exposure amongst people living particularly in informal housing or in areas with limited green spacing or limited access to cooling. The exposure to heat levels can be really astounding for many of these urban residents. And the third reason is really at this point in the world, there's tremendous opportunities for providing care services for heat-exposed populations. And reanalysis of data can inform these solutions around things like early warnings, cooling services, but more broader public health responses to limit the harms of extreme exposure. So the HE2AT Centre generates the knowledge, and then we'll take advantage of the opportunities to provide care services for populations. The HE2AT Centre has four aims. Firstly, we prepare a data science ecosystem, and this enables the reuse of existing health, environmental, and other data. It also serves as a platform for the innovative data science analyses that we conduct. The second aim was to increase knowledge, but also to develop novel solutions to address these critical research priorities. The third aim, and really something that cut across all of our activities, was to advance capacity for the application of data science with a focus on early career researchers, a large cohort of researchers that over the last 5 years, we have really built their capacity. And lastly, we serve as a center of excellence, informing policy and practice through engagement and partnerships, and really have been drawn into policy and other projects and multiple areas we have provided support across the continent and globally as a center of excellence, stemming from the work of the HE2AT Centre. As Brad described, it falls within the DSI Africa initiative, the greatest project that I've been involved in or seen over my 20 years of research. So the HE2AT Centre aims specifically to cover east and southern parts of Africa. So most of the partners were in South Africa, Zimbabwe, as well as Ivory Coast. And over the study, we also had several pilot projects and additional cheeky year one grant also formed part of the broader HE2AT Centre, and we work with the University of Washington and the University of Michigan across the project. So the HE2AT Centre has it's structured into 4 parts. So underscoring all of our work is the admin core, who coordinates and does financing reporting. So data management and analysis core. This is the key part, and Chris Jack will get into this in more detail. This harmonizes these large volumes of data that we have collated over the last 5 years. So harmonization of data. It also was responsible for developing tools for analysis and modeling, and a shared data infrastructure that people across Africa were able to access and analyze in one shared data infrastructure. We have 2 research projects, and we'll get into them in turn as the talk evolves. The first one is individual participant data meta-analysis across Africa of data from cohorts or trials in pregnant women. And then the second one is an urban heat vulnerability assessment in Southern and Western Africa, 2 cities across Africa. And like I said, training and engagement cut across all of our activities. So we're in year 5 of the project. I'm going to pass over to the next speaker, but just to show on this slide some of the rich experiences from capacity building, team building, etc. So I'm handing over to Chris Jack from University of Cape Town. He's going to discuss some of the key aspects of the data management and analysis work. Over to you, Chris. Thanks.
Yeah, thanks, Matthew. And great to have all the participants. As Matthew introduced the different parts of the HE2AT Centre, and we're going to start off by talking about the data management and analysis core, DMAC. You can progress to the next slide, Matthew. So this really sort of forms the engine room, if you like, of the HE2AT Centre, and we've spent quite a bit of time and resources in the project trying to build this analysis core. And fundamentally, what we're trying to do within the HE2AT Centre and what DMAC enables is to bring together different data sets. So Matthew's already mentioned some of the health data sets that we bring in and the harmonization process. Nick is going to talk after me about the harmonization process in more detail. But basically, we're pooling together multiple biomedical data sets from different countries across Africa, different types of studies across different time periods. So a very large data harmonization and pooling process and challenges associated with that. We're also bringing in climate and other environmental data. Key characteristic of climate data is very large sizes of data. They're big data sets, not the kind of data sets we can move around easily. And then socioeconomic and other data related to vulnerabilities, and particularly for the urban study that Matthew mentioned. And really the center of this is bringing all these different data sets together in a harmonized way that enables innovative data science and statistics to be developed, and then that knowledge dissemination and moving towards public health solutions. So that's the core of what we're trying to do. Go to the next slide, Matthew. So the challenge of bringing all these data sets together is not insignificant. We knew it was a big challenge when we wrote the proposal, and it has turned out to be a really big challenge, one that we've risen to really well, I think. Fundamentally, there's a huge challenge around sharing and moving sensitive health data across country borders, considering multiple legal and ethical frameworks. So we spend many, many hours and months actually wrestling with the different ethical and legal frameworks involved in this, engaging with data providers. Sometimes studies were done many years ago, and it takes a long time to engage with the original study leads. So there's a huge amount of work that's gone into that, and the team has done an amazing job to bring all these data sets together. Clearly, a key thing around this health data is that it is sensitive data. Often the original data sets do contain personal identifiers. So the first action is to remove these personal identifiers and have very tight access control to ensure that the sensitive data is protected. And then bringing all these data sets together in a harmonized form, as again, Nick will talk more about that, combining with the climate data sets. This really requires essentially a centralized data store, particularly because the climate data sets are so large, and therefore a centralized data analysis platform. Let's go into the next slide. So we developed this data analysis platform, which is a web-based. It uses Jupyter Labs. So it allows the researchers across the team, across all the countries involved in the HE2AT Centre to access this common platform where we can develop code collaboratively. We can share code. We can access the data sets, again, in a secure, controlled way. We access the petabyte scale climate data. And also behind this is the technical analysis support for the researchers. This has been a big part of the capacity building as well. I must just comment on that. Matthew mentioned capacity building. This has enabled early career researchers to upskill, to learn how we write this kind of code, to work with more senior researchers, to access the technical support for developing this kind of code, for sharing code. And so it's been a significant part of the capacity building project. I just want to make a quick mention of the UCT. We provided the data analysis platform initially. We are a research organization, so there are some limitations around long-term support and availability. So we're currently in the process of transitioning parts of the data analysis platform to the Azure cloud, just to provide a more sustainable and high available solution. And I believe at this point, I'm going to hand over to Nicholas Brink, who's a climate and health researcher at WITS PHR, and he's going to talk a little bit more about the health data harmonization process and a particular project around that. Thanks, Nick.
Thank you, Chris. As Chris has highlighted, undertaking this kind of project relies on a really vast multidisciplinary team, and it can be exceedingly complex. The process of bringing health data, geolocating it, and linking that to environmental data in order to perform quite complex analyses requires expertise that isn't available to everyone. And so today I'm going to be talking about the Harmonize project, which is an NIH-funded supplementary grant to the HE2AT Centre. And what the Harmonize project is looking to do is to bring together all of the experience, all of the expertise within the HE2AT Centre and package it into an easy-to-use interface. And so Harmonize is available today as an open source toolkit that can be deployed in a research environment. And it has 4 components. The first is the ability to ingest heterogeneous research data and use novel AI methodologies to actually harmonize this data to a target codebook into one unified data set that's optimized for federated analysis. This data set is then geocoded using a black box geocoding approach, which preserves privacy, which is really important, as Chris mentioned. And importantly, it leverages the ability to use multiple different platforms. And this is really important in areas which don't have good coverage, and that's often outside of cities, in more rural areas, and in lower middle income countries. This then enables us to link the environmental data. And what's nice about this is that it's very scalable. So once you have this data in a specific format through this toolkit, you can actually link multiple variables, multiple data sets. You can just tick a box and it provides a fast and efficient code-free linkage of that data. Once this is all done, it then produces an analysis-ready dataset. And that dataset can be deployed to a server like DataShield for federated analysis, or it can be put through a standardized dashboard so that you can have some code-free analysis, which is really optimized for large-scale analyses of the impacts of heat. If you can go to the next slide, Matthew. Here you can just briefly see what the interface looks like, starting at the left with some of the AI-informed health data harmonization, followed by validated sort of human-in-the-loop geocoding that's preserving privacy, and the climate linkage, where you literally are just ticking a box to say, do you want temperature, do you want precipitation, do you need air pollution in your data set? And on the right, you can see the latest synced data set, which is being served in a privacy-preserving way. So just a brief overview of the Harmonize project before I hand over to Dr. Doshnika Laku, who is standing in today for the lead of the HEath Maternal Health Project. Over to you, Dosh.
Thank you so much, Nick. So I'm going to be talking about our research project 1, which is an individual participant data meta-analysis to quantify the impacts of heat on maternal and child health in sub-Saharan Africa. Next slide, please. So we began the study by conducting a systematic review to find all the longitudinal studies that included maternal and neonatal populations in sub-Saharan Africa. So we found 220 studies and reached out to each of these data providers or through data repositories to request the individual participant data. So the diagram on the left represents our data acquisition pipeline and our current status. So we have 44 studies that are at a data transfer stage. So either data transfer agreements are being signed, or the data is being transferred, or we're waiting for an ethical agreement that was required for the data to be transferred. Then we have 3 studies that are currently being harmonized, and that was what Nick and Chris ahead of me were talking about, the harmonization process. And then we have 27 data sets that have already been harmonized and are currently being analyzed. The figure on the right represents, so that totals 74 data sets. So the figure on the right just shows the distribution of our data sets across Africa. And we can see good representation in Southern, East, and West Africa, but poor representation in Central Africa. Next slide, please. So after acquiring these data sets and harmonizing the health data, we geocoded each individual participant using time, like date of birth, for example, and a location. So using these geocoded locations, we could then link the climate and environmental data to each individual participant using data sets like ERA5, CAMS, and CHIRPS. So the figure on the right represents a summary of the exposure characterization, and this is for 24 harmonized and geocoded data sets. So in our now harmonized data set, we have over 64,000 pregnant women across 600 locations, and we've linked 30 different climate and environmental exposures to each of these participants. And that equated to 22.3 million person days of exposure. So that's for the pregnant woman, 90 days pre-conception, throughout her pregnancy, as well as if the infants were included, so during infancy follow-up. Across our data, the average mean temperature is 24.5 degrees Celsius, which is, I think, around 76 Fahrenheit. And there's a large variability. So we see higher temperatures in places like Burkina Faso and lower mean temperatures in places like Ethiopia. And what I wanted to also highlight is that our data spans pregnant women living in both rural and urban areas and across a number of different climate zones. And this richness and the variability of our data really allows us to explore vulnerability and risk factors. I'm going to now be handing over to Dr. Perkins Watambwa from SESHA, who's one of our lead statisticians, to present some of our results.
Thank you very much, Dash, for the introduction. So I'll present on some example of the work which we have been doing. We have looked at maternal and heat, specifically preterm birth, seeking answers on whether higher temperatures in the week before birth are associated with increased odds of preterm birth. We used individual participant data from 15 studies, that is around 10,110 preterm birth cases. Our exposure metric was the minimum temperature over a 7-day window before birth. We have found that compound exposure to high temperature day 1 and 2 before birth shows to be associated with the risk of preterm birth. These findings were from a distributed leg nonlinear models which we fitted with 2-stage meta-analysis. Within these two days legs, we found that minimum temperatures above 30 degrees Celsius is also associated with higher odds of preterm birth. This suggests that even short-term heat exposure may trigger early delivery, which is a critical insight for heat warning system and maternal care guidelines. We also were curious about higher temperature and increased risk of hypertensive disorders in pregnancy. So we conducted a pilot analysis using the precise cohort with 5,545 pregnant women from the Gambia, Kenya, and Mozambique. We used average temperature during preconception and each trimester as an exposure. From that, we fitted a logistic regression where we control for country, maternal age, and other variables. From this work, we have found that for every increase in temperature during the first trimester was associated with a 9% higher odds of hypertensive disorder in pregnancy. This is striking because the first trimester is a critical window for placental development. Therefore, heat stress may be triggering vascular changes that lead to hypertension. We also looked into the effect of landscape fire. Next slide, please. We also looked into the effect of landscape fire smoke on birth weight. The specific question we were trying to answer was whether prenatal exposure to landscape fire smoke is associated with lower birth weight. So we then use a trimester-specific average exposure. We then use a trimester-specific average exposure to fire smoke, a particular matter 2.5, and modeled birth weight as a continuous variable. We utilized the generative additive model with distributed lag function. And for this model, we also adjusted for non-fire PM 2.5 as well as other variables. And we have found that heavy wildfires, smoke exposure during third trimester was associated with lower birth weight. This suggests that wildfire smoke, which is increasing in Africa, may harm fetal growth through inflammation or oxidative stress. At this point, I'm going to hand over back to Dr. Dash.
Thanks, Perkins. So I just have one summary slide just to talk about how we can apply these analyses in a public health way to inform program and policies. And one of these ways is through heat and maternal, neonatal, and child health specific indicators. So our results have contributed to the WHO, UNICEF, UNFPA, WMO guidelines on indicators for heat and maternal and child health, which will come out in a report later this year. One of our PIs of the study has also been awarded the Working Group 1 lead on the Lancet Countdown. So that is a great opportunity to feed our research into heat and MNCH specific indicators for Africa. We've also been working with local stakeholders in Zimbabwe and in South Africa to incorporate heat and MNCH indicators into routine health data collection. And then finally, as illustrated in the figure on the right, we can use our data to map heat attributable outcomes like preterm birth to quantify burden of disease across locations and countries. And indicators importantly track burden over time. They can be used to track the effectiveness of interventions, which can all be used to calculate the economic cost or burden of disease, which can be used to motivate for financing, all of which contributes to important action on heat health impacts. Thank you. I'm going to be handing over to Dr. Sibusisiwe Makhanya from IBM Research Africa.
So thank you, Dashnika, and good evening, everyone, and thank you for joining us. So I'm going to be talking about the work that we're doing, looking at various health risks that arise in urban environments as a result of exposure to heat, and how might different circumstances, such as the socioeconomic circumstances and the prevalence of certain conditions, may lead to either amplify or reduce the adverse health outcomes that we see in urban environments when we look at exposure to heat. So our study, if we go into the next slide, for this part of our work, we focused on 2 cities, again, in sub-Saharan Africa. We focused on Johannesburg, specifically the Johannesburg municipality, which is part of the Gauteng city region in South Africa, as well as Abidjan in Cote d'Ivoire. again, here, it was important for us to look at identifying various cohort studies that might help us to look at biomarkers of morbidity as a result of heat stress, so that we can start to look at how do we actually quantify heat hazard, specifically in urban environment. What kind of heat indices should we be looking at? If we're looking at temperature, should we be looking at specific quantiles of temperature? What are the relevant lags when it comes to urban environment that we start to see, these biomarkers of morbidity becoming more significant, which may indicate, incidences of adverse health outcomes to urban populations. What we had hoped is that these findings would then inform the development of heat early warning systems, specifically in urban environments, and also informed by some of the contexts that we see in areas like in sub-Saharan Africa. In terms of the cohort studies that we had acquired over Johannesburg and in Abidjan, we had a total of about 27, split between 19 and 8 in Abidjan that are almost ready for analysis. At the core of the work was this notion of using the risk framework, which looks at the combination of hazard, exposure, and vulnerability to really quantify what is the risk to health of being exposed to heat hazard specifically. One of the nuanced aspects of our work was really taking a deeper look when it comes to quantifying vulnerability and starting to incorporate beyond just sex and age, which we know that, people of that are elderly or that are very young tend to exhibit more vulnerability when it comes to heat. We also incorporated aspects that took into account access to healthcare, socioeconomic status, but also some of the environmental characteristics of our urban environments to consider when we're quantifying vulnerability. Next slide. Starting with the first aspect, an important point is how do we quantify heat hazard specifically? We do know that, when you're looking at heat stress, it's not just what's your temperature as measured by the various instruments that we use to monitor weather in any environment. How heat feels for different individuals can differ markedly from what we measure. And so there's also an opportunity to look at moving from what we quantify as surfaces of ambient temperature to different indices or indicators of physiologically based thermal discomfort indices. So first part of the work that we did on recognizing the importance of getting very high resolution ambient air temperature information was to look at how do we downscale from some of the more widely available reanalysis data that we have on ambient air temperature, which is at a 9-kilometer resolution. How do we start to move to scales that are relevant if we're looking at, inner city type of analysis? And for this, one of the approach was looking at combining an open source physics-based weather prediction model. Specifically, we looked at the WRF and combining it with a machine learning based approach, specifically self-organized maps that help to capture some of the nuances that we see in urban environments caused by the heterogeneity of the urban landscape fabric. So we use the self-organized map to capture that heterogeneity, as well as the physics downscaling approach to then come up with a very high resolution ambient air temperature surface for the cities that we were focused on, which was Johannesburg and Abidjan. If we go on to the next slide. There is also an abundance of satellite information that tell us a lot about the thermal surfaces and the emissivity of heat specifically. So the land surface temperature is data that is available from satellites like your Landsat at 30-meter resolution. One of the challenges with these data sets is that obviously for any given area, you have a gap of about 16 days, which is the time between the satellite overpass over that specific area. Now, if you are looking at relating health outcomes to exposure to heat, you need data that is available daily. And so for use of land surface temperature for the kinds of analyses that we were interested in, we needed to have to produce these daily data sets. And the approach that we then follow was leveraging satellite information, specifically an integrated data set from Landsat 8 and 9 together with Sentinel, where we're then able to produce through a generative foundation model, land surface temperature for any given city at a daily time scale. Now, what was novel about this particular approach is we were able to leverage the ERA 5 land data sets in terms of the ambient temperature, together with the 16-day apart LST, and use a generative transformer model to then produce data at a daily time scale that wouldn't otherwise be available. And so this was one of the highlights in terms of the work of being able to produce alternative proxy information when we're looking at the quantification of heat in urban environments. We move on to the next slide. Another important thing is to start to look closely at how, the characteristics of an area really shape the thermal characteristic of that particular region, and how it differs for areas that are quite close to each other in the urban areas that we are studying. So this is Johannesburg. We have two specific areas. On the left, the bigger square shows a region that covers Sandton. Sandton is a suburban area, a built-up suburban area with lots of vegetation, well-planned suburban area. And then on the right, we have Alexander, which is a township area characterized by dense shack dwellings. So these are like corrugated iron type of structure, and very little in the way of vegetation. What we can see when we're looking at the urban thermal field variance index, which gives you a sense of heat for a particular area relative to the rest of the region, we can see that an area like Alexander tends to be quite significantly hotter than what we find in areas such as Sandton. So this information was quite important if we move on to the next slide, when we were considering the development of the heat vulnerability index, because we wanted to then consider these environmental characteristics of these areas together with information that is more demographic in nature, that information that captures what is the socioeconomic circumstance in those particular areas. But also, importantly, we also incorporated information about the prevalent health condition in these areas. And this was then, integrated through a geographically weighted principal component analysis to then produce an index of heat vulnerability in Johannesburg specifically. What we then found was that the heat vulnerability in areas such as Alexandra and other areas which have predominantly dense informal settlements tends to be much higher than in still urban environment, but that are well planned and with high degrees of vegetation coverage, but also from a socioeconomic standing, more affluent areas tend to have lower vulnerability. So this was the finding in Johannesburg. What we then wanted to see was, if we move on to the next slide, what some of the findings that we found in Johannesburg, do they translate at a city far from Johannesburg, west coast of Africa, Abidjan? Are there commonalities in some of the factors that we're picking up as indicative of heat vulnerability in Johannesburg? And again, perhaps what was different in terms of the framework that we applied when we were quantifying vulnerability in Abidjan was that there needed to be more consideration of indicators of water and sanitation, because for some of these areas, that was a major issue when it comes to access to water and also access to good sanitation. And so these factors were then incorporated into the vulnerability indicator for Abidjan. But interestingly, in terms of the findings, similar findings to what we found in Johannesburg, where areas that have greater heat vulnerability are those areas where there's a high density of informality, less greenery, fewer access in terms of access to healthcare, as well as other services that are necessary for coping with some of these heat events. If we move on to the next slide. The other thing, when it came to some of the work that we did in Abidjan, so in Johannesburg, we managed to leverage a rich household survey data set that has been run over multiple years in the Gauteng city region. So it was already existing household survey data, but in Abidjan, the team actually designed a survey that they ran during the earlier phase of the project. And interestingly as well was the deployment of sensors that would then collect information around some of the climate variables like temperature, humidity, but interestingly also looking at air quality. So the combination of exposure to heat and poor air quality over Abidjan was something that was differentiated from some of the earlier work that we had been doing in Johannesburg. If we move on to the next one. I think, part of what has been great about doing the projects, both in Johannesburg and Abidjan, has been seeing how in Abidjan we could be able to go a bit further in terms of engaging with the community. From early on in the project, there had been various workshops to engage stakeholders, ranging from communities to government officials and policymakers, to be involved in the design of some of the household survey, to be involved in some of the deployment of the sensors that were deployed, as well as then be involved in the latter parts of the projects in disseminating some of the findings that we're finding from the projects, specifically that are relevant in Abidjan, but also what has been learned from the work that has been done in Joburg. So with that, I would leave it then to Matthew to do the summary.
Thanks, Sibu and team. So what I want to conclude with is the public health use of the data and the analyses that have been done in the research work in Johannesburg and Abidjan. So all of that data we've understood on vulnerability and heat exposure aims to feed into early warning and response systems. So globally, there's a lot of work being done to develop hazards and warning systems, but a lot of it doesn't provide enough detail. In other words, the thresholds may target the whole general population without having clear thresholds for triggering warnings and tiered responses that are tailored to one's actual risk in different populations. So the heat vulnerability mapping and the heat health analyses we do aims to provide this information to refine the thresholds used in warning systems. We're going to close by briefly overviewing some of the work we did in training and engagement across the centre to build capacity and engage more fully with the community. Just one of the highlights was the HE2AT conference, which was held in Zimbabwe. Really, this is the largest conference on climate change and health that's been held in Africa by some distance. Around 230 abstracts were presented, and over 6 days with a large number of health ministers, the president of Zimbabwe, amongst other dignitaries. And as I mentioned in the beginning, a lot of time was spent together as a group in training through DSI Africa annual meetings and dedicated training workshops. So I'd like to conclude. I think what's clear across all the slides is that there's marked challenges in doing data reanalysis at scale. The time-consuming work, of securing data and then ensuring safe access to that data. And working across the continent and interdisciplinary collaborations, a lot of us use very different terminologies and maybe different cultural, different ways of working. So there are a lot of challenges involved in bringing together such a large collaboration, but also many joys, and we've all learned so much together as a team about each other and about the work in the continent. And I think finally that it's very clear to me as these analyses have evolved, just in each of them we find the real risks of heat exposure amongst these vulnerable populations. They're underappreciated. And even as a team, we continue to be amazed at the depth and the breadth of vulnerability that groups like pregnant women, infants, and urban populations face. And yet, there's very limited monitoring systems and protective services in place for these groups. There's really this dissonance, and the HE2AT Centre, I think, was aimed to be part of addressing both those two problems. Highlighting the risk and also some protective solutions. I'd like to acknowledge the team. It's a very large collaboration, and of course the NIH Science Officers, Brad Newsom, and our Ethics and Legal Services group. Thank you. Back to you, Brad.
Okay, there we are. Thank you for a great presentation from our HE2AT Centre team, Matthew, Chris, Nick, Darsh, Perkins, and Sibu. You see those claps coming in. A phenomenal presentation. You all have accomplished a lot over these 5 years on a topic with major and constantly increasing importance and implications. So thank you so much for sharing this with us. We have had a couple questions come in already. I encourage you to put your questions in the Q&A box, and I'll read them aloud to our speakers. Also, thank you for those who have already put in questions into the chat. I'll start with your questions. If you would like, you can also use the raise hand feature to ask your question directly to the HE2AT Centre team, and you'll be given microphone and video access. To start off, this is an easy one. This is for Nick. You had a question around the GitHub repository, where that can be found for Harmonize. And maybe you can say it out loud and type it into the chat feature or as a response to the Q&A.
Yeah, I think it'll be best to put it in the link. Strangely, the search engine optimization isn't great on that, but I will share the link in the chat. Will probably be easiest. And hopefully we will have this ported over as an official release and the Harmonized Consortium soon. But Great. You can access it here in the meantime.
Great. This has been, as you can imagine, this has been of significant implications for our DSI Africa program, trying to figure out, as many of the people on this call have dealt with, the harmonization of data sets, disparate data sets, not only similar data sets that use different metrics, but then also across the heat and health spectrum, you have a lot of different ways of collecting and interpreting data. So this Harmonized project has been a critical one across our Data Science for Health Innovation in Africa program, and really happy that Nick was able to share it. Next question up is for Perkins or Darsh. Where possible, have you also produced these data for other important thermal indices and exposure, for instance, wet bulb, global temperature, and University Thermal Climate Index, not just ambient temperature? Perkins or Darsh?
Yeah, thank you very much for this question. Yes, we have included all other different kind of exposures, including WBGT, UTCI, the minimum temperature, the maximum temperature, as well as the average temperature. So this was just a snapshot of our work, but we have a lot of other exposures which we have included in this analysis.
Great. Thanks very much, Perkins. I think this was meant for Sibu. How were you able to segregate the data between extreme heat, air quality, and preterm pregnancy due to linked or unlinked health conditions?
So for I think the pregnancy one is probably for Darshnika or Perkins.
Okay.
So
Maybe Darsh, can you answer that?
Yeah.
Or Matthew?
Yeah, Darshnika, you come in, but maybe these analyses with all these multiple exposures for air pollution, temperature, and a whole range of other weather exposures, that is really difficult to disaggregate, and much of the literature does then tend to go down into a single exposure. But Darshika, I don't know if you want to add. She also led this systematic review of around 200 studies that examine temperature, but often without getting into air quality. But what are your other thoughts, Darshika?
Sorry, Brad, I was actually going to ask you just to repeat the question.
So it was about how are you able to segregate the data between extreme heat, air quality, and preterm pregnancy due to the linked or unlinked health conditions?
Yeah, I think, as Matthew mentioned, it is quite tricky to discern the differences between those two, and we do try to control for a lot of different confounders, but it's not perfect.
Yeah, I think that for a lot of us doing this kind of work across disparate data sets, that is a little confusing, but we're doing our best to figure it out. I do just have a comment from Regine Dutard from our Office of Research on Women's Health here at NIH, and she's providing some big congratulations to the team around the importance of this area and how it's often overlooked. So maybe we can set up a time to talk with Regine after this. She's a phenomenal advocate for global research on women's health. Another question from Darby Jack. Can you describe the process for selecting reanalysis data and why ERA5? And did you run any sensitivity analyses to assess sensitivity of results to choice of reanalysis data inputs? Not quite sure who that would be best geared toward. Maybe it's Chris.
Yeah. Maybe Chris and Sibu, but go Chris first.
Yeah, I can start as the climate scientist in the room. So yeah, we've done a lot of work comparing ERA5 with other climate reanalyses products and different observational products across Africa. We've got various results around that, including looking at how they translate into heat extremes data sets. And clearly there are differences. The work we did for Gauteng on the urban heat exposure, we noticed really good agreement between ERA5 and station data, observational station data in that context. But it's an important question. I think our guidance would be that we always need to ask that question, which is the best data set, compare it to other data sets. There are biases in these data sets, and particularly when we're looking at these kind of absolute temperature thresholds, those biases are important. So yeah, really, really good question. Sibu, I don't know if you want to add to that.
No, I think you covered it well, Chris. Thanks.
Great. Thanks, Chris. So another question that came in, and again, I encourage you to continue putting questions into the Q&A, or you can use the raise hand feature. So another question around daily thermal data. Is this available across the discussed areas only? And is this publicly available and is accessible? And if you could give any guidance on how to access it. Maybe
so
that's again to you, Sibu?
Yeah, so there's two that I gave. So the one was the high resolution ambient temperature data that was produced by the combination of a WRF and the self-organized map. So that was done specifically for Johannesburg and Abidjan. So there's a paper in the pipeline for that, not yet publicly available. For the other work on the land surface temperature, we actually produced a model. So it's called the Granite land surface, geospatial land surface temperature model. It is open source, available on Hugging Face. So then you are able to use that to produce for a city of choice to be able to then generate land surface temperature for that city using that pre-trained fine-tuned model for land surface temperature. So those are the two products that we have.
Great, thanks, Sibu. So I encourage you again to put your questions in the chat or raise your hand. Matthew, I see your hand going up, but before that, I do have a question for this group. And it's because we've got a pretty big mix of people that are on this webinar today, and a lot of graduate students and postdocs on the call. I know some of the challenges that we've overcome and dealt with along the way during these 5 years. What kind of advice would you give to some of these postdocs or graduate students trying to work in this intersection of heat implications of extreme weather, of in the population scale, at working with a lot of disparate data sets? What kind of guidance would you give them to not perhaps repeat some of the challenges that you had along the way? Maybe that's to Matthew and perhaps to Nick.
Yeah, indeed. So I think at the beginning, someone said you'll spend 95% of your time on preparing the data and then 5% on analysis. And I think that's probably was about correct. So I think it can be a bit disheartening to face some of the barriers to data access. And that has probably been our biggest lesson of how we've worked and learned over time. And we've got so much better at it in the last year or two, how to efficiently in a trust relationship access data. And I think so, that would be my biggest advice for people to think through and really try to make that process as smooth as you can. The second part is that, and this came up in all of our questions so far, the exposures, there's multiple ways of measuring them. And they're so diverse. And again, with the health outcomes, you could slice it and analyze this data in so many multiple ways. So if someone is doing a project, I would really encourage you to find something that a question you think is particularly interesting in this space. There's so many gaps on this topic. Find something innovative, something that hasn't been done, and you'll almost certainly will find strong association and useful information for that topic. And find something new. Let's make sure we're all doing new things and not repeating. Nick.
Yeah, it's an excellent question. I think maybe, just to add that everyone faces similar challenges, and that's at least what Harmonize tries to do is try to say, okay, everyone's facing similar challenges, we can solve it once. And what we've learned through that project is invariably someone has solved the problem. And so that's what's so good about working in an open science way. And we're lucky within the HE2AT Centre that we have experts. We have machine learning specialists like Sibu, climate scientists like Chris, and statisticians like Perkins, who you can lean on. And these days, with the amount of information that's available on the internet, with new AI tools, you're able to kind of leverage that expertise where previously you weren't able to. And I think that's what's so nice about the DSI project is developing open source data science tools that are reusable, that can actually sort of democratize the analyses that are needed. And those kinds of tools are really key. Someone solves your problem, and often through work funded by the NIH. So I'd really encourage people to try and reuse tools that are available and leverage the kind of expertise that is available out there through published workflows or through attending conferences where people present their solutions to these problems.
And I think pretty importantly to this group is that GitHub repository, so they can understand how you're doing what you're doing to make this perhaps a little easier. So Matthew, over to you.
Yeah, thanks. I think we've covered that in the last question. I think mainly one of the things I did want to highlight that what I'm hoping this project will achieve is to just raise the profile of heat-related research. This is an exposure that has a remarkable health burden, and yet it's very few researchers are focusing on this. And these frank adverse health outcomes that are experienced during heat waves in many of these communities, and the discomfort and the mental health ramifications. I think I really encourage people to take this up as a topic. There's so much that's unknown in this area.
Yeah, well, and that's probably a pretty good place to stop. So I do see Guéladio finally on. Guéladio is the lead for our community engagement and training within the HE2AT Centre. And Guéladio currently has malaria. So thank you so much, Guéladio, for joining us. And any final thoughts?
Yes, I'm going out of a crisis, so I'm not so strong, and I'm afraid that I could have some mix on my thoughts. But your question is really, really important. I think it's at the heart of what we try to achieve these years of collaboration. I think the project has an impact of at least two aspects. The first one is a change in mindsets about data. Data sharing is not so obvious that in many universities or academic ways of thinking that you can share your data and you can gain more impact on health and research with sharing your data. You have more impact. The second dimension of what the project is making some basis for the next generation is the existence of the repositories that we are talking about. Today, the academic universities that we are gathering in our annual workshops, they know what is as a resource at the University of Cape Town with regard to DSI, Africa, with regard to the resources that are there. They know what are there as resources at the Witwatersrand University with IBM Research. So I think we are helping the young researchers coming up with, yes, increasing the knowledge about the importance of data sharing and the existence of resources at the continental level. Over.
Great. Thanks, Guéladio. Great words to end on. I encourage everyone on the call to see that the impacts of heat, it really is a global problem. We have to do some pretty critical partnering outside the US to really understand some of these critical areas of impact, try to overcome them, try to come up with new interventions to deal with them. And thank you again to this team from the HE2AT Centre based at Wits University, but still really a global center. Thank you very much for joining us, and that will conclude today's seminar.